our project on the study Who's Crazy Anyway by David Rosenhan.
Hello, I'm Izzy. I did the key elements, and the key elements for this experiment was that the experiment was centered around testing the ability of mental health professionals and how they assess and correctly categorize between the mentally ill and the mentally healthy individuals and how their symptoms compare to the setting around them. Um, and it was deemed off of normal and abnormal being opposite sides, these two labels being opposite sides of the spectrum for effective psychological functioning, and the symptoms of abnormality being organized by the context, the persistence, the social deviance, the subjective distress, the psychological handicapped, and the effect on day-to-day functioning caused by the behavior. And mental health professionals were expected to have to use judgment to properly assess where one's behavior relates to and how detrimental they are for the day-to-day psychological functioning and for the medical admittance that they sought. I also wrote the hypothesis theoretical proposition, and it was questioned if if psychological diagnoses were based in the patient's reported characteristics, or if it was due to the association of abnormal characteristics to a mental health facility from the professional during the intake. It was theorized that characterizations of behavior were swayed by the setting of a mental health facility into the misdiagnosis of abnormality, as if the professionals would expect the behaviors were automatically abnormal due to the patient willingly wanting to be admitted over their behavior. Um, Rosenberg spoke that if mental health professionals have received proper training in diagnosing mental illness, then those individuals would be able to differentiate who is struggling with mental illness and who is not when requesting psychiatric admittance.
My name is Nora, and I'm going to be talking about the methods. So, Rosenhan recruited 8 patients, 3 women and 5 men, including himself, and they all posed as pseudopatients in 12 different psychological hospitals. All of the patients were to follow the exact same steps. So, they called the hospital to make an appointment, and upon arrival, the patients would claim to hear voices but have no other symptoms. Participants gave truthful intake interviews, and all but one were admitted for schizophrenia. Once they were inside the hospital, pseudopatients acted normally and dropped any of their pretend symptoms. The goal was for all participants to get out as soon as possible while cooperating with staff. And as far as the results, one of the key findings in the study was that no pseudopatient was detected by staff. When released, all patients' mental health status were recorded as schizophrenia in remission. While the hospital staff did not detect pseudopatients, 35 of 118 real patients were suspicious that the participants were not really mentally ill. Contact between patients and staff was minimal, with doctors often ignoring patients' questions. The 8 pseudopatients were given a total of 2,100 pills that were not swallowed. It was noted that even some of the regular patients would secretly flush medication down the toilet. Many interactions between patients and staff showed that patients were often not seen as real people, with one instance of a nurse unbuttoning her shirt in a room in front of male patients, not to be provocative, but simply because she didn't consider them as people.
Hello, I'm back for the conclusion and the discussion, and the results suggest that the mental hospital setting imposes a skewed judgment and perception of all the behaviors in a patient to the psychiatric professionals. The patient becomes the diagnosis before an individual with symptoms to the professionals when they are inside the facility. And it was also noticed that the history of patients were written down in certain perspectives compared to how the individual reported them. Statements such as minimal spankings being interpreted as spankings are commonplace in the household by an interviewing doctor. And though it is believed that the perceived distortions were not added out of malicious intent or lack of care, but a stern trust in the presented diagnosis of schizophrenia.
My name is Mushtagh, and I did the implications for the study. And so we found that there were two. Rosenhan's study pointed out two major factors. The first one being the sane cannot be distinguished from the insane in a mental hospital setting. Rosenhan's work led to more careful diagnostic practices and a heightened awareness of the risks involved in labeling patients. The second implication being that diagnostic labels can be very dangerous. When someone is diagnosed with psychological condition, that label tends to overshadow their other traits, and their actions and personality are viewed only through the lens of that disorder. There were two major recent applications that were inspired by Rosenhan's work. A study done by psychiatrist Thomas Saz argued that mental illness is purely a consequence of one's environment. He claims that mental illnesses are not diseases, but instead problems in living that have social causes. Broughton and Chesterman conducted a study to see whether people will fabricate mental illness symptoms in social situations, such as fabricating mental illness in order to avoid punishment or shame.
Hello, my name is Marlasia, and I did the peer review studies. The first one is called New Revelations about Rosenhan Pseudo-Patient Study, Scientific Integrity and Remission. This article is published in the peer-reviewed journal Scholarship of Teaching and Learning in Psychology. The key points were it explores the Rosenhan pseudo-patient study from today's perspective, draws attention to questions regarding the accuracy of stated pseudo-patient experiences and numbers, suggests it's possible that Rosenhan overstated or misrepresented his findings, and highlights the importance of carefully assessing early psychology research. The second peer review study is called Rosenhan Revisited: Successful Scientific Fraud. This article is from a peer-reviewed journal in the history of psychiatry. The key points are Scholl challenges the accuracy of Rosenhan's research by revisiting his initial claims in light of archival sources analyzed by Susanna Collins. He argues that the study is a spectacularly successful case of scientific fraud, indicating that although Rosenhan's study had a significant impact, its empirical foundations are questionable. Despite its criticisms, Scholl points out that Rosenhan's work sparked long-lasting shifts in the conversation surrounding psychiatric diagnosis and psychiatric practice.